are being shown this video because your doctor has recommended that you have a procedure called an ablation. The aim of this video is to talk you through the procedure and the benefits and risks that are involved. An ablation is a procedure used to treat abnormal heart rhythms that are called arrhythmias. These arrhythmias can cause people to experience their heart to race, shortness of breath, or pain in the chest. However, some people have an arrhythmia with very mild or even no apparent symptoms. There are many different types of arrhythmia, and your doctor will have discussed what type you have before the procedure. When you arrive at the hospital on the day of your ablation, you will be met by a member of the team who will go through your details before getting you prepared. There may be some waiting time before the procedure, so it is a good idea to bring a form of entertainment to keep you occupied. The procedure takes place in the catheterization lab, which is similar to an operating theatre. When you enter the room, you should expect to see a large amount of equipment, and there will be a number of staff members who will greet you and explain where you need to be positioned. There's usually a lot of setting up to do before the procedure starts, so do not be alarmed by this. Most people will not need general anaesthetic for their procedure, but we can give you some medication that will allow you to relax, and you can discuss this with the team beforehand. If you do need a general anaesthetic, your doctor will have discussed this with you in advance. Once everything is set up, the procedure will begin. The heart is accessed via the blood vessels in your leg. You might feel a brief sharp scratch as the local anaesthetic is inserted at the top of your leg, but after this, everything will go numb. From the leg, a number of small tubes are passed into the heart. You will not feel these tubes moving around, although occasionally people can feel their heart racing momentarily, which is quite common and nothing to be alarmed about. Once the tubes are in the heart, we will perform a number of different tests to confirm where the arrhythmia is coming from. Again, this might result in you feeling your heart racing briefly, but this is perfectly normal. Once the arrhythmia has been identified, the ablation part of the procedure can start. This is done by cauterizing very small areas of the heart. Occasionally, some people might feel a burning sensation when this is happening, but you will be given pain relief medication via a tube in your arm before the ablation begins to prevent this. Again, you can tell the team if you are experiencing any discomfort. After the ablation has been performed, the testing can be repeated, and if everything has been successful, the tubes will be removed. Usually, the blood vessels in your leg will self-seal after the doctor has pressed on them for a short time. However, it is very important that you keep flat and listen to the instructions from the nursing staff after the procedure. The duration of the procedure will vary, but the team will keep you updated throughout. The long-term success rate of ablation will vary between people and also the type of arrhythmia you have. Your doctor will discuss the outcome with you after the procedure. However, for many people, ablation is a cure for their arrhythmia, and they will no longer experience it. It may also mean that you no longer need to take some of the medication you were previously taking, but your doctor will discuss this with you afterwards. On rare occasions, it may not be possible to identify where your arrhythmia is coming from. If this is the case, ablation will not be performed and your doctor will discuss alternative options for treatment with you. A cardiac ablation is a very safe procedure, but there are some risks involved. On average, complications occur in less than 3 in every 100 ablation procedures, but can include damage to the blood vessels in the groin, bleeding or swelling around the heart, stroke, and needing a pacemaker afterwards. Life-threatening complications are fortunately very rare and occur in less than 1 in 1,000 procedures. Following your treatment, you will either be discharged home the same day or simply be required to spend 1 night in hospital, so it is important to bring an overnight bag with you. The recovery time from an ablation procedure is usually very short, but you will be instructed to take it easy and refrain from driving for at least 48 hours after the treatment. This video has been created by the electrophysiology team at the Morriston Cardiac Centre, and we hope you found it useful. If you want to read more about these procedures, the British Heart Foundation and Arrhythmia Alliance websites are excellent resources. If you have further questions about the procedure, please feel free to contact a member of our team.